Good day, everyone. Today we will be discussing two medical devices that can help you make sure you are healthy and alert at the same time when something is wrong. If you are concerned about your health or you just want to make sure you are prepared, thermometer and pulse oximeter are among the medical devices you should consider keeping in your home. So this will be the summary of what we will be discussing throughout the presentation. For both thermometer and pulse oximeter, we will be tackling under descriptions and its different types, including their illustrative parts and the definitive function of each. Second would be the applications of these devices or in what disease or injuries these devices are used. Next would be the stepwise procedure of its actual use. And lastly, additional information that is worth taking into consideration. Aside from the two devices mentioned, we will also provide a brief discussion regarding the new device that is recently introduced to the medical field. Let's now start with thermometer. But what is thermometer? The word is made up of thermo means heat and meter means to measure. Basically, thermometer is an instrument for determining temperature, and it is usually consisting either of a device providing a digital readout or of a glass bulb attached to a fine tube of glass with a numbered scale and containing a liquid that is sealed in and rises and falls with changes of temperature. Thermometers measure temperatures in degrees according either the Celsius or Fahrenheit system. Let's now proceed to the different types of thermometer. The first one is the digital thermometer. It is the most accurate and quickest way to take a temperature. It uses heat sensors which determine body temperature. It is usually placed in mouth, rectum, or armpit. To achieve accurate reading, it should stay for about 1 minute or less. The second type of thermometer is the oral thermometer. From the name itself, it is orally used or through the mouth, and it is most accurate in children over 3 years old and in adults. The reading is 98.6 degrees Fahrenheit or 37 degrees Celsius. However, any oral temperature ranging from 97 degrees Fahrenheit to 99 degrees Fahrenheit or 36.1 degrees Celsius to 37.2 degrees Celsius is considered typical. The third type of thermometer is the digital tympanic thermometer, or it is also known as the digital ear thermometer. This measures the temperature inside the ear canal through infrared ray technology. This provides fast and accurate readings. For both tympanic and temporal, readings are typically 0.5 degrees Fahrenheit or 0.3 degrees Celsius to 1 degree Fahrenheit or 0.6 degrees Celsius higher than oral temperature readings. The next type of temperature is the temporal thermometer. It is also known as forehead thermometer, which uses infrared sensor to measure temperature of the superficial temporal artery. Advantages of this type of thermometer are fast reading, easily as administered, and accurate. For the fifth type of thermometer, we have app-based thermometer. It made use of free phone application designed to take temperature from the digital thermometer that link back to the app via Bluetooth connection. This is usually used orally, rectally, or under the arm. Among the advantages of this is the fast reading and log keeping of multiple people's temperatures. Down to the sixth type of thermometer, which is the pacifier thermometer. It is used as a pacifier for babies to get their temperature. Easy recording is achieved since babies will suck the thermometer just as like the usual pacifiers. For the last type of thermometer is mercury thermometer. It is also known as liquid in glass thermometer. It is the only option available for taking temperature before. It is no longer widely available due to safety concern. It also provides accurate temperatures readings and most likely used orally, rectally, and under the arm. The good thing about this thermometer is there is no need for batteries. Let's now proceed to the illustrative parts and function of the specific thermometers. First, for digital thermometers, it has a sensor, which is the part that should be in the direct contact of the user. Second would be the display window or the LCD. This will show the temperature or the result. Generally, it shows 1 decimal place only. Next would be the on or off button, which is then pressed to on or to off the thermometer. Lastly, the battery cover or the one that shields the area where the batteries are placed. For our forehead or temporal thermometer, we have the LCD display, which has the same function with the display window of digital thermometers, as it also shows the result or the temperature. Next would be the mode section, which is a button switch to forehead mode and ear mode. Then, up and down button, which is an adjustment to read high or low. The trigger, then the IR sensor, which detects infrared radiation, and the battery cover. For our pacifier thermometer, we also have the display window, which shows the temperature, and this is usually attached to the ring of the pacifier. Next would be the nipple. This is a silicone plastic rubber part where the infant suckles upon. Lastly, the guard, which protects the infant from swallowing and choking the pacifier. This guard is between the display window and the nipple. For our last type of thermometer, which is the mercury thermometer or the liquid in gas thermometer, this comprises of glass tube, the one that holds the glass bulb, then the glass bulb which contains the mercury. Next is the scale, which tells how far the mercury rises and goes down to determine the actual temperature. And lastly, the mercury. This is the liquid inside the bulb which rises when hot and goes down when it is cold. Before we continue, why do you think we should take our temperatures? Or why should we use these thermometers? Come to think of it. So, checking our body's temperature with a thermometer is an easy way to see if a fever is present. But what is a fever? Fever is a rise in the body's temperature, and it is usually caused by an infection. Though fevers can be uncomfortable, they are a sign that the body is fighting off infection. Let's now proceed to the steps that you should consider in using these thermometers. First, let's focus on the use or the steps for digital thermometer. The first step is to remove the patient's shirt and place the thermometer tip into the armpit. Make sure that the armpit is dry to get the most accurate reading. Second step would be keeping the thermometer in place by folding the patient's arm across his or her chest. Just a reminder, the thermometer will beep when reading is done. This method may take longer than 30 seconds. So for our third step, remove and record the temperature and the time. Next, or the last step, clean the thermometer with soap and water or with alcohol, always rinsing as a last step. For our digital oral thermometer, our first step would be washing our hands with soap and warm water. Then, make sure to use a clean thermometer, the one that has been washed in cold water, cleaned with rubbing alcohol, and then rinsed to remove the alcohol. Third thing that you should consider is to not eat or drink anything for at least 5 minutes before you take your temperature, because the temperature of the food or beverage could make the reading inaccurate. You should keep your mouth closed during this time. For the fourth step, we have place the thermometer tip under the tongue. For the fifth step, hold the thermometer in the same spot for about 40 seconds. Just a reminder, readings will continue to increase and the Fahrenheit or Celsius symbol will flash during measurement. So, usually the thermometer will make a beeping noise when the final reading is done, usually about 30 seconds. If you are keeping track, record the temperature and the time. That would be the sixth step. And for our last step, rinse thermometer in cold water, clean it with alcohol, and rinse again. So for the next type of our thermometer, we have tympanic thermometer. So the first step is to pull gently back on the top of the ear to open the ear canal. Then place the protective cover on the tip of the thermometer. And for the third step, as you can see in the picture, gently insert the thermometer until the ear canal is fully sealed off. Next, press and hold down the button for 1 to 2 seconds until you hear a beep. Then for the last step, remove the thermometer, discard the cover, and record temperature and time. So we are now down to the second to the last type of our thermometer, which is the temporal artery thermometer. For our first step, we have turn the thermometer on, then place the protective cap on the thermometer, and as you can see in the picture, sweep the thermometer gently across the forehead so that the infrared scanner can measure the temperature of the temporal artery. For the fourth step, record the temperature and the time, and lastly, remove the protective cover and dispose it. For our last type of thermometer, we have the digital pacifier thermometer. The first step is to simply have our child suck on the pacifier until it beeps. It usually takes about 10 seconds. Just a reminder, your child has a fever if the pacifier temperature is above 100 degrees Fahrenheit or 37.8 degrees Celsius. For some major takeaways or additional information, first, where to take the temperature. For rectal temperatures, they are the most accurate. Forehead temperatures are the next most accurate. Oral and ear temperatures are also accurate if done properly. Hence, temperatures done in the armpit are the least accurate. However, armpit temperatures are useful for screening at any age. Second, some of the temperature taking heats that we should consider. Make sure you let your thermometer acclimatize to room temperature at least 10 minutes before you're taking the measurement. The person being measured should be indoors for 30 minutes before taking a measurement. Additionally, before taking a measurement, wipe away any sweat with a dry cloth. Ensure that the area is clean. So if you clean your forehead and armpit, wait for 10 minutes before taking a measurement. Lastly, make sure to move hair away from forehead and wait 10 minutes before taking a measurement. Next, what temperature is considered a fever? For adults, 100.4 degrees Fahrenheit or 38 degrees Celsius or above. It can be treated at home with fever reducer medication and fluids. However, 104 degrees Fahrenheit or 38.8 degrees Celsius or higher, home treatment does not lower it. Seek or call for a healthcare provider or your physicians.
The pulse oximeter. It is a non-invasive and painless test that measures your oxygen saturation level, or the oxygen levels in your blood. It can rapidly detect even small changes in how efficiently oxygen is being carried to the extremities furthest from the heart, including the legs and the arms. There are different types of pulse oximeters. The first one is the fingertip pulse oximeter. It is the most common used at home, hospitals, clinics, and other facilities. The second one is the handheld pulse oximeter, where it is utilized in hospitals and ambulatory health settings. The next one is the tabletop oximeter. It is a pulse oximeter that is ideal for hospitals and in subacute settings. The next one, wrist-worn sensors. It is a wireless model monitoring on daily basis or during sleep. The next type of pulse oximeter is the fetal pulse oximeter. It is a pulse oximeter that is used only for neonates. Now let us see the different parts of the pulse oximeter and their function. In the upper part of the pulse oximeter, you will see a red light, which is the light emitting diode or the LED. This shines red and infrared light through the fingers. In the middle port is the microprocessor, which measures the changes in the wavelength and absorbance of the light in the arterial blood. In the bottom port of the oximeter is the phototransistor, or the detector, which releases the information to the microprocessor. As said earlier in the previous slides, the pulse oximeter is used to measure the blood oxygen levels. For example, how much of the hemoglobin in the body is carrying oxygen. This provides an accurate reading in the blood oxygen saturation and pulse rate. The normal oxygen saturation of a healthy individual on room air is 97% to 99%. As you can see in these slides, these are the conditions or disorders that one can use a pulse oximeter. First one is the chronic obstructive pulmonary disease or COPD, asthma, pneumonia, lung cancer, anemia, heart attack or heart failures, and congenital heart defects. These following conditions have compromised or have a disorder in their lungs, in their blood wherein the hemoglobin is not enough, and their heart. Here is the stepwise manner of the actual use of the pulse oximeter. Firstly, select the finger or any other side possible when the finger is not accessible to place the probe. Attach the probe on the finger, ensuring that the light beam and the sensor are positioned opposite each other. Make sure that the patient's hand is positioned at heart level. Turn on the device and watch out for a beep sound followed by the device's display. Wait for the reading, which usually displays after 4 to 6 heartbeats. Record the reading. Remove the probe from the patient's finger. Clean the probe between patients. When using a disposable probe, discard as needed. Here are some additional information when using the pulse oximeter. Remove dark-colored nail polish or artificial nails. Avoid exposing the finger sensor to very bright or changing light while taking measurement. Before using the pulse oximeter, make sure that the finger sensor is dry. When taking the measurement, be sure that the finger is warm, relaxed, and still. Do not use a damaged sensor. Do not let children use the device. Do not apply the finger sensor to a finger on the same arm where a blood pressure cuff is present or has recently been used. Do not use the device with the battery door removed. Use this device only as directed by the healthcare provider. For the new research device, the PEG interferon alpha 2A in combination with ribavirin. This has been used to treat chronic hepatitis C or CHC in patients 5 years of age and older with compensated liver disease not previously treated with interferon alpha. This device is also utilized in patients with histological evidence of cirrhosis, with CHC or HIV co-infection, and with a diagnosis of T-cell count greater than 100 cells per cubic millimeter. The benefits of this device are the following: long-acting than standard interferon HCV therapy, better eradication of virus-infected hepatocytes, better end of treatment response of interferon alpha therapy, fills the gap between ribavirin's minimal effect on HCV RNA levels, and according to Fried and others, 20 O2, ribavirin in combination with PEG interferon alpha 2A have a significantly higher sustained virological response rate than patients receiving PEG interferon alpha 2A alone, about 56% versus 29%.